Hey guys, welcome to today's episode. My name is Gabe Moose, and we have a special episode here for you guys today. We are joined with our local psychologist, Amanda Unsworth, and surgeon, Dr. Alex Hatchell. Thank you for being here with us today. This is a very personal episode to me. The purpose isn't for likes or shares or shock value or anything like that. It's about hopefully someone relating to me or relating to this story and they get help and or saves their life. So before we get started, I have a quick question for you, Dr. Hatchell. Could you please start telling us a little bit about yourself, specifically where you work and your area of expertise?
Sure. So my name's Alex Hatchell. I'm a plastic and reconstructive surgeon who works in Calgary, Alberta. I'm now in my fourth year of practice. I did my medical school and plastic surgery residency at McMaster University in Hamilton, Ontario. And then my Calgary connection came when I moved to Calgary for a year to do my fellowship in trauma and oncology reconstruction. And then in 2020, when I started my practice, by virtue of the pandemic, I ended up going back home to Ontario and working at Queen's University for a year before then relocating back to Calgary in the fall of 2021. My current plastic surgery practice is largely provincially based healthcare. Where my main focuses of my practice, I would say, involve oncology reconstruction for both breast cancer as well as melanoma and other cutaneous malignancies, and also in gender-affirming care, and then basic plastic surgery related expertise like hand and peripheral nerve and wound care, etc., as well as breast and body.
Wow.
Cool.
That is amazing. It's nice to hear it all laid out. You're a very impressive woman, that's for sure.
Well,
good
thank
for
you,
you.
Gabe.
I'm really happy for you. I saved this episode for last specifically because I wanted our listeners to get to know me better first before, passing judgment or whatever. Some might not think this is a typical men's mental health issue, but to me it is because, I was actually born female, and I know this might be surprising to some, but I also realize that some of you may feel uncomfortable with me sharing this part of my life, but that's okay. We'll get to know each other better. But if you listen to the previous episode on the men's shed, you'll know that I'm a part of that community, a diverse group of men from all walks of life. There's conservatives, farmers, welders, electricians, and more. At the shed, I'm simply known as a man. I'm Gabe, and I don't bring that part of my life up there because, for one, it's a safety issue. There's a lot of assaults that have happened not in my life, but in the general aspect of being trans. Two, it's no one's business. It's okay for me to tell that as I need and to say it as I need. It's not an obligation to anybody. And I just want to be myself. I'm not here to push anything on anybody. I'm just here to be me. Men's mental health has always been really important to me, even before my transition. But as a man today, it's even more important. It's more critical. In this episode, I've invited Dr. Alex Hatchell, a surgeon, and Amanda Unsworth, a psychologist, to provide insights on the facts, address misconceptions, and clarify misinformation regarding gender-affirming care. So, Dr. Hatchell, do you consider yourself a provider of men's mental health care?
It's an interesting question. When I think directly about providing mental health care specifically, I would say probably not. I was trained as a surgeon, not necessarily as a psychologist or a psychiatrist. But I think indirectly, my line of work probably does assist with men's mental health. So thinking about it both through gender affirming care for trans men, allowing them to restore their body image and self-esteem the way that they want to be seen, which can be a contributing piece to improving upon their mental health. Also with men who I work with who have had severe defects to their body created through oncology and oncologic defects after cancer resections, and rebuilding that for them, and also helping to restore body image and self-esteem in cis males, for instance. I also deal a lot with the bariatric community, so for body contouring after massive weight loss, both men and women. And again, it's helping to rebuild a body and an image that someone feels comfortable with and confident with, and that helps rebuild and strengthen their own mental health. So I think I am a contributing piece to mental health, but a direct provider of mental health care, as one might perceive it to be with psychologists or psychiatrists, I would say, no, I'm not trained in that regard. But I look at myself as a technician who can help improve that aspect of someone's health. As we all know, that health is a global topic and not just physical health. It's, comprised of physical and mental health. So I think I am a contributing factor and person in various men's journey, whether cis or trans, in order to try and improve upon one's self-image, self-esteem, perceived self-worth, and then therefore by virtue of that affecting their mental health.
Absolutely. And I think we have cool talks on this podcast about mental health really being like a connection to yourself, a connection to other people. And the health part is that. The mental illness part is the diagnosis and the assessments and those pieces. But the mental health part is really like living your authentic life and feeling connected to who you are and the people around you. And I think your work is very impactful in that regard.
How much of your practice is focused on gender affirming care, even though I'm pretty sure you just basically answered that?
It's definitely changing landscapes, because as you build your practice kind of takes a direction one way or another, and it also depends on where the needs are in the community. A large part of my practice is oncology reconstruction and oncology through breast cancer and melanoma and cutaneous malignancies. And I would say that my gender affirming care part of my practice probably makes up about 20 to 25% when I think about it. And it's always in flux, because when my oncology practice is high, obviously the elective non-oncology practice has to take a bit of a back seat for me to be able to prioritize the active oncology cases. And then by virtue, when the oncology cases have a lower volume, then I'm able to focus more time on my elective and work through more of my elective list for gender affirming care. But I would say probably, yes, my practice is probably about 20 to 25% of gender affirming care.
That's awesome.
Yeah, that's definitely quite a bit in my opinion, considering how many patients you probably have.
There's a lot.
So how would you rate the success of gender affirming surgeries in terms of functionality, aesthetics, recovery, and potential complications?
I think it's very high. I think, I can really only make judgments on the basis of my own practice with my patient population, because obviously it's different for everybody and everybody has a different approach. But over the past 3 years of providing gender affirming care, because I really only started providing gender affirming care when I moved to Calgary, there just wasn't much of a population that we treated in Kingston, Ontario at Queen's, probably just by virtue of the fact that there were Ottawa and the Toronto as the major centers on either side of the city. So I assume the gender affirming care was more focused in those two cities. So I just didn't see it in Kingston as much. So yes, my experience is largely related to that of Calgary in the past 3 years. Generally speaking, I would say my patients, my gender affirming care patients, are probably amongst some of my happiest patients in my practice, and also some of the most thankful. By and large, I would say that when I am seeing a patient post-operatively and asking how they are feeling and what they like versus what they don't like, it is very rare for me to leave a room or an interaction with a patient where a patient is very upset with me about what has happened to their body. There is a lot of discussion of regret in the literature and in pop culture, and to this day, at least on the basis of my patients, I've never had a patient voice regret to me. And what I would say is working with this particular patient population has been some of the most gratifying for me. Because at the end of the day, I'm just trying to do good and to help somebody. And that's why I went into medicine, and I'm sure we'll get into it later, but that's one of the reasons why I still perform gender affirming care, even though it can be a polarizing topic amongst friends, family, other people in the medical community. But I get some of the most heartfelt letters or kind gestures from patients. Just last week, I received a beautiful hand painting from a patient to demonstrate their gratitude. You yourself, Gabe, gave me a beautiful piece of kitchen cookware that I use and I treasure. And I think that those small gestures to me demonstrate that there is a success. And also through patient words to me about how they are now able to participate in life as their true self and find true happiness and allow the world to see them as they wish to be perceived. And so for me, I do think it is a very successful surgery in the correct candidates and the people who are screened appropriately and who are also managed by a multidisciplinary team who have provided the appropriate care, confirmed the appropriate diagnoses, and have supported that individual. I don't necessarily think that this surgery is for everybody, but I think when properly supported and evaluated, the patients who move through this pathway and who are selected for the surgery when it's right for them, I think there is a very high degree of success.
100%. Yeah, the process I went through to get top surgery with you was lengthy, but it was worth it. I'm more than happy to wait as long as it needs to have the most wonderful surgeon give me the body that I feel like is me. And like, look at this. Like, that's a fancy chest right there.
Yeah.
And
No, it's awesome. You're right. I think one of the frustrations for this patient population is the lengthy access to care. But I also think that it is a part of our healthcare system. We just have to accept it. That is what our publicly funded healthcare system can provide. But also the fact that because it is such a lengthy process, and we're talking years, and even talking years once you meet me, not necessarily years of when you are going through the process to get to me, but because of those years to eventually see a surgeon like myself, I also think it allows people like yourself to like truly live in and embrace that gender role and be able to know that this decision is the right one for you and it's not rushed. And it also allows people that if they begin going down a road where they think that they may have gender dysphoria and wish to live in an opposite role or a non-binary role to what their cisgender is. There's also time that if that doesn't work or if they change their mind, then they have time to move back. I think there sometimes can be a public misconception that you get the diagnosis of gender dysphoria and tomorrow you're getting top surgery, when in fact that is not the case. And it really allows people to think about that. Even yesterday, I met somebody for consideration of top surgery. And when they were referred to me 2 years ago, they thought they wanted to go completely flat, but now they are more in a non-binary role. than a trans man role, and so instead have different goals and objectives for their top surgery rather than going completely flat. But they have been given the opportunity to really make that decision and make the decision that's appropriate for them and the way that they perceive their body and their body image without being rushed into it. So I think it's both a blessing and a curse, to be truthful.
100%.
Yeah.
Yeah. Like the process is a process, but it definitely gives you time to think about the little details and the thing. And you learn a lot about yourself in that time. You learn a lot. It's definitely worth the wait, in my opinion. How do you see the relationship between gender affirming surgery and mental health? Like, what kind of mental health benefits have you observed in your patients post surgery?
Kind of like what I was touching on before, I think it comes down to a lot of body image, self-esteem, perceived self-worth because of the body image and self-esteem, and feeling comfortable in one's skin. I also think that for many people who are born women but would like to be a trans man or would like to at least be flat, what that provides by virtue of not having breasts is the ability to partake in society, go to work, go to school, go to events, where with clothes on, people have no idea what your story is. And so you can be your true self without having judgment cast upon you by others, where that judgment might be in place if you are attempting to live in a different gender role, but still have secondary sex characteristics which suggest otherwise. And so I think what I believe the connection to be is truly about allowing somebody through this surgery to be able to live in a body that they are comfortable with and that they are able to live their life with. And I think we all know from all walks of life, whether you are cis or trans or somewhere in between, that when you are most comfortable in your body is when you are like most your true self and usually your most happiness. And so I think that gender affirming care in that way provides that connection and provides the connection of the disconnect between the body and the mind and how the mind perceives the body to be when the body is not that. So I see it as that connection. And that connection is also very true in my oncology world as well, because one might think that their body part that was affected by either trauma or cancer should work or look one way, and it doesn't. And then our role as reconstructive surgeons is to rebuild it so that it can work, function, and look like one would want it to. And then rebuild the body image and self-esteem. It's a very common thing, and it's top of mind because October is Breast Cancer Awareness Month. But for women with breast cancer or men with breast cancer who have to undergo mastectomies, and for some people, breast can be a defining part of who they are, and therefore providing that reconstruction for those individuals really does wonders on self-esteem. And I think that is the same for the trans community with top surgery.
Honestly, from my point of view, I never really thought about it from an oncology perspective. That's interesting.
Yeah.
Another thing, Dr. Hatchell, that when I'm talking to Gabe, I hear a lot is not only like your work's amazing, your team and your aftercare is also very gender affirming. And that's, I think it really just like, he lights up, like he's just like, yeah, like this is great. And your team just recognized right away, like he's a he, him, this is who he is. So let's use those terms. And I don't know, in some medical situations, that's not the case. And so I think that part is also really important and really impactful to people.
Yeah, and you know what? It makes me smile, and I can't wait to tell all of the staff at the clinic that that's why you feel that way. But when our clinic was kind of designed and created, the main theme that we wanted our clinic to be was that feeling of inclusivity, where it is a space that everybody is valued and will be treated with respect. And so that's been a huge pillar for our clinic and all the people who work at the clinic to embody that idea and that role. And so it makes me really happy to hear that that comes across to patients. And I am very grateful to my team. I could not do what I do without my phenomenal office assistant or my phenomenal nurses or office coordinators or receptionists, because we really are a team. I don't answer the phones every day because I'm working in the hospital, but they answer the phones and the nurses are answering questions so that I can also focus on my patients at the hospital while still being able to provide appropriate care. So having that collegial base is so important and so crucial. And it just makes me really happy to hear that that was a good experience for you and appreciated, and that embodiment of inclusivity was felt and recognized and, felt to be true, which it is.
It was very freeing to be treated like how I'm supposed to be treated, but like at the same time, it was really, I had honestly a really fun experience. Like it's supposed to be, painful, but I had a lot of fun. I was worried I was going to burst my scars from laughing so much.
That's good.
So for the next question, we talked about a little bit about misconceptions, but for you personally, or well, I guess you professionally, what do you think the misconceptions are for gender affirming surgery and healthcare?
One of the misconceptions is that we're offering this to everybody. Somebody can come in off the street and just say, I want top surgery because this is how I'm feeling this way, and that someone will do it. That is not the case. At least in my situation, in my clinic, and at least amongst the surgeons in Calgary, that is not the case. There is, in fact, a very rigorous process for individuals to go through, such as yourself, and you can speak to that process that you went through. But there is a very rigorous process where, in order to have top surgery, you must have a clinical diagnosis of gender dysphoria. You must live in that gender role for a period of time before surgery is even considered. And a great deal of time and effort goes in with both patients and surgeons alike to ensure that the surgery is right for the patient. And not everybody is accepted. And I've had situations where patients have come to me, do not have a formal diagnosis of gender dysphoria, and come to me for other reasons, like a quote unquote breast reduction, when then we find out that they truly want mastectomies, and I have to politely and decline and advise them to go back to their family practitioner in order to explore their thoughts and feelings more, and then be relocated to an appropriate treatment path before they come to me. I think there's also misconceptions about the level of regret. As I said, I personally have not experienced regret in this patient population. I have experienced patient regret in other situations, and it's a truly awful thing to go through when a patient says to you, I regret what you have done to me. And so that is something that I hope that, by the end of my career, I can count on one hand of the patients who say that to me, because when you are part of this job to make people's lives better, the last thing you want to do is for somebody to tell you that you've made their life worse. But I do think that there is a misconception about regret, and other gender affirming surgeons, Dr. Blair Peters, queer surgeon, he was my year. He trained at another Canadian center the same as me, and I follow him by virtue of being co-residents and also colleagues now. He speaks a lot to this as well. But I think one of the biggest misconceptions is that it's unregulated, and it's not. It's very regulated in Canada. It's very hard, in fact, to be able to gain access to gender affirming care in Canada. In Alberta alone, it's extremely hard for individuals outside of Calgary to receive this care by virtue of lack of providers outside of the city of Calgary. So, in a year, half of my patients may be from Calgary, but the other half may be from Edmonton or Grande Prairie or Red Deer or Lethbridge, and traveling hours to see me and hours for their surgery because access is not widespread. It is challenging. So I think those are some misconceptions that the public possibly holds.
Thank you for saying all those amazing things. It was very validating and appreciated. Like, that's definitely how I feel, and to hear it from you is something else and very powerful. So thank you very much, Dr. Hatchell. That's exactly how I feel. In your personal life, do you face any stigma for providing gender affirming care?
I don't necessarily think I face stigma. I do face some questions. I don't hide that I provide gender affirming care. In fact, if you Google my name, my office will come up, and where it talks about my practice, it clearly says that. Also, I think a lot of Google hits are like my name on Reddit streams for gender affirming care. So it's not a secret. I do get friends and family who kind of question why I do it. Because it is polarizing, it can be stigmatizing. And my answer is really quite truthful, which is, I think this group of patients deserves to receive care. I believe that the care is meaningful. I also believe that the patients are appropriately selected and cared for by a multidisciplinary group of individuals who, by the time the patient reaches me, they have a very clear diagnosis. There is no question that these individuals are suffering for a variety of reasons and deserve to have surgery to allow them, as we talked about, to achieve the body and self-image that they desire. I also truly believe that this surgery makes a difference for people's lives, and I also believe it saves lives. And I have had many patients who have told me that the only reason that they are still on this earth and are happy is because they met their gender care team and they eventually had surgery with me. And my answer to people is that if I can save one life by doing this surgery, I think it is by far worth it. And I stand tall on that. I don't think that, my beliefs or my family's beliefs or my friends' beliefs or my acquaintances' beliefs, I don't think any of that should impact on how we provide care. As physicians, we took our Hippocratic oath, which said that we would provide care to all of those in need and be undiscriminatory regarding it. And as I said, I think it's meaningful. And I think on the basis of the letters that I have received from patients telling me that this saved their life, I think is enough, where when I say that to individuals, the questions generally stop and we move on because they think, yeah, that's meaningful. So that's why I do it. And that's usually how I approach a conversation if someone asks me about why. Because it's really not about my own political beliefs or someone else's political beliefs. I'm not here to take sides. I'm just here to provide care to my patients, and I'm not discriminatory about that. And yeah, it's important to me. And people think of doctors as saving lives, and so if we do save lives, that usually shuts the conversation down pretty quickly for anything negative.
You definitely save lives. You can attest to that one, that's for sure. All the work you do is just impeccable. I without you, you can't imagine how, can you imagine without you, how many lives would be different right now? You're an amazing surgeon, and I appreciate you being here. What's your most rewarding part about being a surgeon?
I think my most rewarding part is things that I've said. It's
Yeah.
when I actually hear from patients and or see them. At a first post-op visit or 3 months later when things have settled out and looking a little less crazy. But like that just genuine smile on their face and on their families' faces. And just the actual gratitude that they've had at the care that you've provided. Again, whether it's because you have reconstructed them from a terrible defect that they had from either a trauma or a cancer, or I've fixed somebody's hand that doesn't work, but now they can put on gloves and use tools and be back doing the things that they enjoy. Or someone like yourself, where they're now finally in a body that they love and appreciate and they can flourish in their life. That's what makes me come to work every day, is the fact that I have a very privileged role where I can do that for people. And that's meaningful for me. And that's why my practice has predominantly stayed within the public sector realm, and I'm not interested in the other aspect of plastic surgery. I shouldn't say not interested, but it does not give me as much fulfillment as some of the work that I do within the public realm. Because I do think that by providing new form or function back to somebody that they had lost in some way is so incredibly important. I don't think you can put a price tag on it.
No.
But that's what makes me get up to work every day and push through, even when I'm going through a really tough complication with somebody and it's really tough on them and it's also tough on me. But you kind of push past that so that you can still offer the care to others.
Sounds really rewarding, to be honest. If I was to put myself in your shoes, I don't even know.
When I listen to you talk about your work, Dr. Hatchell, it's very compassionate in like a very authentic way. Like you just have a beautiful philosophy, and you've built your practice upon that philosophy versus having a practice and designing a philosophy around it. And I think that authentically comes through to your patients. I know for Gabe especially, but that's amazing. That's very client-centered kind of care. And has huge impacts in mental health, but huge impacts in just authentic connection. And so that's really cool that you've built a practice, and I hope it's tremendously successful for you because it's really cool work that you are doing.
Thank you. That's truly one of the best compliments I can receive. So I appreciate it very, very much.
So I wanted to talk a little bit about the process to getting on hormone treatment or hormone replacement therapy and all that. Like the wait times, you can't just walk in and get it done. You like, I had to go and see a family doctor who he was like, if you would have asked me this 10 years ago, I probably would have said no. Like he straight up said that to my face. And I'm like, oh, but I'm glad you're doing it now. So thank you.
Good thing it's not 10 years ago.
Good thing it's not 10 years ago. So he sent me a referral to the gender care at the University of Alberta. And then you have to wait to see somebody to diagnose you. And then you have to wait to go on testosterone to see an endocrinologist. And you have to get your blood work done. And it's a whole process. Once you figure out who you are a little bit, it's about like the 1.5 year mark by now. And then you can get a referral in for top surgery. Actually, I think my referral went in near the 6-month mark. But it was about a year before I seen you, I think. And then after the consult, it was like about 1.5 years.
Yeah, and unfortunately, my times are getting even longer. I think on average now, I'm probably seeing people about 2 years after the referral is sent. And wait times now to get into surgery are about 2 years. So after I meet you, we need to wait another 2 years. And to be fully transparent, because of my wait times, we don't accept top surgery referrals right now, just because I do strongly believe that it's unfair to accept referrals when wait times are so incredibly long. So the goal is to get the current wait list back to a more manageable level rather than, 4 years from when you get referred to when you get your surgery. And then once, as we catch up, then we open back up again. We're just not there yet. And I don't think that my situation is any different than any other surgeons in Calgary, because of the challenges with access to care in Alberta with lack of providers. There's a lack of providers in Edmonton who provide it as a provincially funded procedure. So we see tons of individuals from Edmonton. We have our brand new surgeon, Dr. Peter Mankowski, who's joined our team, who did his fellowship in gender affirming care. And we're so thrilled that he's here. And he has very big aspirations for the gender program in Calgary. And he's truly such a wonderful individual. And if anybody can do it, he can. And we're just happy he's here and helping. But, he's only been here for a month and he's already inundated. So it just goes to show what the demand is. And unfortunately, right now, the amount of surgeons that can help treat that demand just are far too few to manage it in a timely way. So, as you know, your timeline is relatively quick in comparison to the way it is now, but it's still very long.
I've been in contact with many trans people, and yeah, their wait times are definitely getting longer. But at the same time, I feel very thankful that we have a healthcare system that allows us to be who we are. So that's just where my brain goes. I'm just so thankful. And like, if anyone's out there waiting, like you'll get there. Don't worry. So Amanda, I had a question for you. When someone gets diagnosed with gender dysphoria, I'm basically going off, online.
Okay.
It's a mental illness, but what's the treatment plan?
Well, that's the thing. So, it is a disorder in the DSM. So, yeah, we would call it a gender dysphoria as a disorder. The treatment plan is to have your body match your gender. The dysphoria comes from not that. So, the cure is that congruency between how you view yourself and how the world views you. And we can be dysphoric in lots of ways. So, gender dysphoria is one way that we're dysphoric, but there is physical dysphoria in all kinds of different parts of your body. Gender dysphoria gets a lot of news time, but dysphoria occurs in all kinds of situations.
Yeah, if you don't like your hair,
Yeah, I have hair dysphoria. I can't go to the hairdresser.
Yeah.
You can get a wig even.
Yeah,
Be any kind of hair person I want to be.
100%. So that's the answer is
And it's not simple to go in and get a gender dysphoria diagnosis either.
No.
You can't just go to the doctor and be like, I think I have gender dysphoria. And they're like, yep. No, it takes a long time. It takes many years. There's lots of questions we ask. In my practice, in my experience of the people that I've met, it's not they woke up one day and was like, this will be fun. This is a long-standing thing. And yeah, we wait to make sure this is not a phase or a thing to even receive the gender dysphoria diagnosis.
The big misconception that you could just walk in and get things done is just out of this world.
Which, have you ever tried to get anything done at the doctor? Because even my normal doctor things call the doctor, I'm really sick. And they're like, we can get you in 3 weeks. Well, I'll be alive or dead by then. So thank you. So to change my gender, yeah, that's going to take a minute.
Yeah, a little bit. A good way I wanted to explain this, because a lot of people get gender and sexuality mixed up. Gender is who you go to bed as, and sexuality is who you go to bed with. So that's how I kind of learned, because I grew up in Sexsmith. I grew up in a redneck area. I'm learning. I get in trouble from the trans community because I don't know all the terms, but I'm learning. And it doesn't make me anything less. It just
makes you human.
Just makes you human. Everyone learns every day. So another big misconception is that we're trying to get a P in LGBTQ for pedophilia. And I just think that's just needs to be disputed right now. Sure, there's extremists in every group. There's bad people in every group, every religion, culture, whatever you want to say. There's probably a trans person that is a predator, but that doesn't mean we all are. There's bad people, good people in every group, and you can't just stereotype us as one thing. I'm not pushing nothing on nobody's kids. I honestly don't even have children in my immediate life. Like, I'm just being me. I'm going about being me. And honestly, it is a little awkward in the beginning of a transition. Like, people don't know what gender you are. I've had children ask me if I was a boy or a girl, and I'm like, it's wonky, but you'll get there, and it's all part of the process. The fear of pushing things on children is just fear. It's just misunderstandings, and transphobia is rooted in fear. People are like, oh, I'm not scared of trans people. Well, the definition is, it's not just being scared. It's the hatred and the prejudice and the discriminatory behavior, the physical harassment and the verbal harassment. That's all transphobic behavior. It doesn't just mean you're scared, but it can. So nature's cool. Seahorses, like, male seahorses give birth. Like, that's nature. It's natural. Clownfish are born male, but the dominant individual in the group will change into a female as the need arises. Like, how can you say that's not natural? It happens. The debate, though, on the chromosomes, I want to shed light a little bit on that. Like, I'm not like a biologist or anything like that, but the research I've done, like, there's so many characteristics to biology. It's not just black and white. You're not just male and female. There's intersex. There's all sorts of stuff, which people also say is not natural, but like, it happens. It's natural if you're born with it, right? So the basic chromosomal understanding of sex is not the full picture of human biology. As sex development is also influenced by hormones, gene expression, and other factors. Variations in the expression of sex chromosomes can result in diverse biological outcomes. So while it's commonly taught that XX equals female and XY equals male, this binary model doesn't account for intersex conditions, which some may say is not natural. But it very much is. Gender is a social construct. Like, if you think about it, like, humans made up, like, literally every word. Like, we didn't just, like, wake up with a medical textbook.
I would also go back to your argument about where the animals are showing us that in nature we can have a diverse expression of these things. Animals don't have gender, so they aren't identifying themselves by a gender necessarily either. So we don't know. I've never asked my dog how she would like to present to the world, and it doesn't matter. And I would argue the same for all animals on Earth. It doesn't matter. There is zero, I think, traits in the DNA spectrum that are binary completely. There is always differences. That's what makes us awesome.
And too, like, different cultures appreciate the gender diversity as well. Like, being Two-Spirit in the Indigenous culture, like, I'm Native myself, and I don't identify as Two-Spirit, but I vibe with it. Like, it's a whole thing. They are respected within their community. Like, they're spiritual leaders, they're meditators, they're mediators, they have special gifts, and they can connect different genders and bridge the gap between the tribe or between themselves, internally, externally.
They're like problem solvers, uniters.
Yes, exactly. So it's a huge identity that encompasses gender and spirituality, culturals, and it's not a new thing. Ultimately, aren't we all on a journey to find our authentic selves? And isn't the goal to build a meaningful life, true to who we are? So that's the goal of this whole podcast, is to honestly, for someone to hear a story and to relate and either get help or relate to it or save their life. And I just want to thank you guys both again for being here. It is you have no idea how much it means to me, Dr. Hatchell, that you're here, and Amanda, that you're here. Thank you for doing this for me. Again, thank you very much. I really appreciate it.
You're very welcome, Gabe, and I also commend you and your bravery for being open with, a podcasting community that can reach all people. And I commend you on your efforts. What you have done is very brave as well.
Thank you so very much. I appreciate that. It's definitely different, but it's worth it, I think. All right, guys, I hope you have a wonderful day, and thank you for listening.